Hello, Bennington. On this segment of Bennington Smiles, we will address the impacts of smokeless tobacco and e-cigarette use on oral health. The negative effects of smokeless tobacco, commonly referred to as spit, dip, chew, or snuff, are well documented. Information on impacts of e-cigarette use on oral health is starting to surface as it becomes more studied and widely used. Both of these forms of tobacco products are advertised as healthier alternatives to smoking tobacco. Smokeless tobacco is marketed under many different brands and comes in multiple forms. According to the CDC, recent trends show an increased use of smokeless tobacco. Just because smokeless tobacco is smokeless does not mean that you are not exposed to the chemicals that are present in combustible tobacco products. Some of the chemicals that are found in smokeless tobacco include polonium-210, found in nuclear waste, nitrosamines, cancer-causing chemicals, formaldehyde, embalming fluid, nicotine, an addictive substance, cadmium, used in batteries and nuclear reactor shields, cyanide, a poisonous compound, arsenic, a poisonous metallic element, benzene, used in insecticide and motor fuels, lead, a nerve poison. All of these have been shown to be cancer-causing chemicals. Oral effects of smokeless tobacco include oral cancer, leukoplakia, which are great white patches that can be precancerous, tooth decay, tooth loss, gum recession, dry mouth, bad breath, staining of teeth, facial malformations due to cancer. However, smokeless tobacco also has more distant impacts on the body, such as esophageal cancer, pancreatic cancer, heart disease, high blood pressure, increased risk of heart attack and stroke, and issues with pregnancy. All of these can start with just a pinch. Smokeless tobacco can not only hurt your health, but can also hurt your wallet. A can a day habit costs around $2,555 per year. E-cigarettes come in a variety of shapes and sizes, some of which are marketed towards the younger population. E-cigarettes are the most commonly used tobacco product among youth. The CDC statistics reports that 3.6 million middle and high schoolers have used a form of e-cigarettes in the past 30 days. That breaks down to 4.9% of middle school and 20.8% of high school students reported use in the past 30 days. E-cigarettes are marketed as healthier alternatives to smoking, and there is truth to that, but only when switching from combustible forms of tobacco. The aerosol that is produced by vaping has been shown to include some of the same chemicals as found in cigarettes. Examples of these include nicotine, diacetyl, nickel, tin, lead, and other fine particles and volatile compounds. Propylene glycol is used as the carrier agent. It breaks down to acetic acid, lactic acid, and more in the oral cavity, which are all toxic to enamel and soft tissue. Glycerin and other flavorings are a major component of e-liquid. They cause a 4-fold increase in microbial adhesions to enamel, a 2-fold increase in biofilm formation, and a 27% decrease in enamel hardness. Nicotine is present in varied amounts depending on the product. It affects blood flow to the gums by constricting vessels and decreases immune cell function, all of which can lead to tooth enamel loss, tooth decay, cavities, tooth loss, and gum disease. Lithium batteries supply energy to vaporize the e-liquid. Lithium batteries can overheat and explode. A study estimated that between 2015 and 2017, 2,035 injuries and burns occurred due to e-cigarette explosions. The severity of these injuries varies. 2 deaths to current time have been attributed to injuries from e-cigarette explosions. Don't let your smile down. Remember to maintain good oral health practices.